Hello, my name is Dr. Sriram Narayanan. I'm a vascular surgeon with the Harley Street Heart and Vascular Center at Gleneagles Hospital. Vascular surgery is the surgery of arteries and veins, which are the blood vessels that carry blood around the body. So really we are surgeons for the circulation. And today I'm going to speak to you about pelvic congestion syndrome, which many people would think is a gynecological condition, but we now understand is actually a vascular surgical condition. So pelvic congestion has got some very clear symptoms. First is related to pain. In mild cases, the pain is usually typical of what you would call a period cramp. Just before the period, day before the period, and the first day of the period is really bad. And then from the second and third day, it settles down. But in people with bad pelvic congestion, the congestion is there throughout the cycle. So they can have pain even in between periods. It never quite settles down. This pain is also positional. It tends to be bad when they are sitting or when they are sort of lying down because the blood tends to pool in the pelvis. Funnily enough, it gets slightly better when they actually stand and walk about. When they are on their side and they sort of curl up in fetal position, the pain gets better, which I think a lot of young girls will tell you actually happens. The second symptom is bleeding. Periods can be very heavy because it's a congested pelvis, which means there's too much vein blood there. Imagine it's like varicose veins in the leg, but except that instead of being in the leg, it's in the pelvis. They pass clots. I've had patients who have periods for 18 to 21 days in a month because of pelvic congestion. Usually the period is slightly longer, or if it's the normal 3, 4, 5 day cycle, then they will give you a history of passing very heavy clots in the first couple of days. The third symptom is related to intercourse, to sex. And it's not just painful sex, which is not that much. Obviously the pelvis is congested during sex. But the typical symptom is what's called post-coital ache. Pain that persists after the act is over. There's this persistent ache that stays. Some women, especially those who've had children and developed varicose veins during the pregnancy, the symptoms may settle down, but their varicose veins, which are connected to veins in the pelvis, the veins in the leg are connected, they get much worse just before the period and during the period, because now the connection is open and instead of the blood pooling in their pelvis during pelvic congestion, some of it comes down into the leg. So you will find that they have bigger varicose veins in the groin, around their private parts, veins in the back of the thigh, which are varicose veins. They are quite typical actually of someone with pelvic congestion. In fact, as vascular surgeons, we treat a lot of varicose veins. But when somebody comes in with veins in the back of the thigh, veins around the groin, I know immediately that they probably have pelvic congestion. Obviously, we don't talk to them about it straight away because it's a sensitive topic, but it takes 1 or 2 consultations to break down the ice. But once you do, you can be sure that they have pelvic congestion. So it is actually wrong to treat their primary varicose veins first. You need to sort out the problem of pelvic congestion before you approach the varicose veins. If you have any queries about pelvic congestion syndrome, or as the new term for it is pelvic venous hypertension, which is the new term that has been recommended, please contact us or contact your family physician or your gynecologist, and don't ignore these symptoms as something that you just need to live with.